Hello, everyone, and welcome to today's session. I'm excited to have you here as we dive into our latest set of questions. Today, we'll be looking at updated questions in a Prometric-style format, complete with options and answers. This is part 3 of our Qatar Prometric Nursing Foundation series. Over the course of this presentation, we'll review key questions, explore different options, and discuss the correct answers to help you prepare effectively. So, let's get started and make this session both informative and engaging. Now, when it comes to checking a pulse during CPR in adults, the most common site we use is the carotid artery. This is located in the neck, just beside the windpipe. It's the preferred site because it's close to the heart and provides a reliable indication of whether blood is circulating. During CPR, we need to quickly determine if the heart is still beating. The carotid pulse is the easiest and most accessible for this purpose in adults. Remember, timing is crucial, so locating this pulse efficiently can make a big difference in the assessment process. Other pulse sites, like the brachial, radial, or femoral arteries, are important in different contexts, but for adult CPR, the carotid is the key site we rely on. This connects to our overall theme of understanding vital signs and how to assess them quickly and accurately in emergency situations. Today, let's focus on the important role of sodium and water in the body. As you know, sodium is a key electrolyte that helps regulate fluid balance, blood pressure, and nerve function. Water, of course, is essential for maintaining overall hydration and supporting cellular processes. When the body retains excess sodium, it often leads to water retention as well. This is because sodium attracts water, pulling it into the bloodstream and tissues. In the context of edema, which is swelling caused by fluid accumulation, retention of sodium and water is a common culprit. So, if a patient presents with edema, it's likely that they are retaining sodium along with water, which causes the swelling. This connection highlights why managing sodium intake can be crucial in controlling edema and maintaining fluid balance in the body. So, when it comes to the normal blood pH, the ideal range falls between 7.35 and 7.45. This slightly alkaline range is crucial because it maintains the body's delicate acid-base balance, which is essential for proper cellular function. If the pH drops below or rises above this range, it can lead to serious health issues, such as acidosis or alkalosis. As we continue, you'll see how the body works hard to keep this balance steady through various buffering systems and respiratory and renal regulation. Remember, maintaining this narrow pH window is vital for overall health and proper physiological functioning. Let's take a look at the options here. We have TB, measles, influenza, and chickenpox. Now, which of these is a disease that requires droplet precautions? The key thing to remember is that droplet precautions are used for illnesses that spread through large respiratory droplets when an infected person coughs, sneezes, or talks. These droplets don't travel very far, usually about 3 to 6 feet, and they can infect others if they land on mucous membranes. So, considering this, influenza is a classic example of a droplet precaution disease. When someone with the flu coughs or sneezes, those droplets can spread to others nearby. This is why wearing masks and practicing good respiratory hygiene are so important in preventing its spread. TB, on the other hand, primarily spreads through airborne particles, which require different precautions like negative pressure rooms. Measles and chickenpox are also airborne diseases, needing airborne precautions. So, to answer the question directly, influenza is the disease among these options that is classified under droplet precautions. This highlights the importance of understanding transmission modes to implement the correct protective measures in healthcare settings. Today, I want to focus on the main purpose of aseptic technique, which is to prevent infection. This is crucial because infections can lead to serious complications and prolong recovery times. By maintaining a sterile environment and using proper procedures, we minimize the risk of introducing harmful microorganisms. This not only protects the patient, but also ensures the safety of everyone involved in the care process. So, while there are other benefits like decreasing anxiety, noise, or providing comfort. The primary goal of aseptic technique is really about preventing infection and keeping everyone safe. When it comes to checking temperature in infants, choosing the right site is really important for accuracy and comfort. The options we have are axillary, oral, rectal, and tympanic. Out of these, the rectal route is generally considered the best site for infants. This is because it provides the most accurate reflection of the core body temperature, which is crucial when assessing an infant's health. While axillary and tympanic methods can be used, they might be less reliable in very young children. Oral temperatures are less suitable for infants who can't hold the thermometer properly. So, in summary, rectal temperature measurement is preferred for infants to ensure we get the most accurate reading and can make informed decisions about their care. When we look at this slide, we're focusing on the patient response. This is a critical component because a nursing diagnosis is fundamentally based on how the patient responds to their health situation. It's about understanding their physical, emotional, and psychological reactions to illness or treatment. The key idea here is that patient response provides the most direct insight into their current condition. It helps us identify what's going well and what needs attention. By carefully observing and interpreting these responses, we can formulate an accurate nursing diagnosis that guides our care plan effectively. Remember, the patient response is what truly informs our clinical judgment. It connects the medical problem, what's happening from a physiological standpoint, to the patient's lived experience. This connection is essential because it ensures our interventions are patient-centered and tailored to their specific needs. So, in essence, when we think about nursing diagnoses, the patient response is the foundation. It's what helps us translate clinical observations into meaningful, actionable diagnoses that ultimately improve patient outcomes. Now, let's focus on a key question you can ask your patients. Are you in pain? This is a closed-ended question, meaning it requires a simple yes or no answer. Asking this helps you quickly determine if pain is an immediate concern that needs to be addressed. It's important because pain can significantly impact a patient's comfort and overall health. By directly asking, you get clear, straightforward information that guides your next steps in care. Remember, while open-ended questions are great for exploring feelings and concerns, closed-ended questions like this are essential for pinpointing specific issues efficiently. So, always consider including this question in your assessment to ensure no pain is overlooked. Now, let's look at the normal urine output per hour for adults. The options here are 5 ml, 10 ml, 30 ml, and 100 ml. The correct answer is 30 ml. This is an important point because it helps us gauge whether the kidneys are functioning properly. In a typical healthy adult, producing about 30 milliliters of urine per hour indicates normal kidney function and adequate hydration. If the output is significantly less than that, it could suggest dehydration or kidney issues. Conversely, if it's much more, it might point to other concerns like diuretics or certain medical conditions. So, maintaining this normal range is key in patient assessment and overall health monitoring. The main goal of health education is to change behavior. It's not about punishing or discharging patients, nor is it simply about reducing nurse workload. Instead, the core focus is on helping individuals adopt healthier habits and make informed choices. By changing behavior, we can improve health outcomes and promote overall well-being. This approach empowers patients to take control of their health and supports long-term positive changes. So, when we think about health education, remember that its primary aim is to influence behavior for the better. So, when it comes to normal hematocrit levels in females, we're looking at a range that typically falls between 36 and 48%. This value represents the proportion of red blood cells in the blood. It's an important indicator because it helps us assess the blood's capacity to carry oxygen throughout the body. Understanding this range is crucial, especially when we're evaluating conditions like anemia or polycythemia. If the hematocrit is too low, it might suggest anemia, meaning there's a deficiency in red blood cells. Conversely, if it's too high, it could indicate dehydration or other underlying issues. Remember, these values can vary slightly depending on the laboratory standards or specific health factors, but generally, 36 to 48% is considered normal for females. This measurement ties back to the overall theme of blood health and the importance of maintaining proper blood composition for optimal bodily function. Now, when it comes to confirming the proper placement of a nasogastric, or NG, tube, there are several methods we can consider. These include auscultation, pH testing, palpation, and patient reports. Each has its own role in ensuring safety and accuracy. However, among these, pH testing is recognized as the most accurate method for confirming NG tube placement. What makes pH testing so reliable? Well, it involves checking the acidity of the aspirated stomach contents. The stomach typically has a low pH, meaning it's quite acidic, which helps us confirm that the tube is correctly placed in the stomach. While auscultation, which involves listening for air sounds over the stomach after injecting air, can sometimes be used, it's not as dependable because sounds can be misleading. Palpation and patient reports provide helpful clues but are more subjective and less precise. So, in the context of patient safety and best practices, pH testing stands out as the most accurate method to confirm that the tube is properly positioned before proceeding with feeding or medication administration. Remember, always combine methods when possible and follow institutional protocols to ensure the best patient outcomes. The correct sequence for donning PPE is gown, mask, then gloves. It's important to follow this order carefully to ensure maximum protection. Putting on the gown first creates a barrier and prevents contamination of your clothes. Next, you place the mask to protect your respiratory system from any airborne particles. Finally, you put on the gloves to cover your hands, which are likely to contact contaminated surfaces. Following this sequence helps maintain a proper barrier and reduces the risk of self-contamination. Remember, the overall goal is to protect yourself and others effectively, so always adhere to the recommended PPE donning order. When monitoring a patient receiving opioids, it's crucial to be aware of potential side effects. Among the options, respiratory depression is the most serious and requires close attention. Opioids can suppress the respiratory centers in the brain, leading to slowed or irregular breathing. This is why continuous monitoring of respiratory rate and effort is essential. While other issues like diarrhea, hypertension, or tachycardia can also occur with various medications or conditions, respiratory depression is particularly dangerous because it can lead to hypoxia or even death if not caught early. So, in summary, always keep a vigilant eye on the patient's breathing pattern and rate when they're on opioids. Early detection and intervention are key to ensuring safety and effective pain management. The first step after a needle stick injury is to wash the area with soap and water. It's really important to do this immediately because it helps remove any blood or potentially infectious material from the skin. This quick action can significantly reduce the risk of infection. Remember, avoid using harsh chemicals or scrubbing too hard, as that could cause more tissue damage. After washing, you should proceed with other safety measures, like reporting the incident and seeking medical advice. Taking prompt and proper action is key to protecting yourself and others in the workplace. Now, let's focus on the key factor in wound healing, which is nutrition. Proper nutrition is absolutely essential because it provides the building blocks the body needs to repair tissue and fight infection. Without adequate nutrients, the healing process can be delayed or compromised. Specifically, proteins play a critical role as they are the foundation of new tissue formation. Vitamins such as vitamin C are vital for collagen synthesis, which is crucial for wound strength and integrity. Minerals like zinc also support immune function and tissue repair. It's important to understand that a balanced diet rich in these nutrients can significantly improve healing outcomes. Poor nutrition, on the other hand, can lead to prolonged recovery times and increased risk of complications. So, in the context of overall wound management, emphasizing good nutrition isn't just a supportive measure. It's a fundamental component that directly influences the speed and quality of healing. Let's focus on electrolyte imbalances, starting with hypokalemia. Hypokalemia refers to a lower than normal level of potassium in the blood. Potassium is essential for normal muscle function, nerve signaling, and maintaining a healthy heartbeat. When potassium levels drop, one of the common clinical signs we see is muscle cramps. This occurs because low potassium disrupts the electrical activity in muscle cells, making them more prone to involuntary contractions. Recognizing hypokalemia is crucial because it can lead to significant complications, especially related to cardiac function. So, in the context of electrolyte imbalances, hypokalemia is particularly notable for causing muscle cramps and should always be considered in patients presenting with such symptoms. All right, now let's talk about the correct angle for intradermal injections. When administering an intradermal shot, the goal is to inject just beneath the surface of the skin into the dermis. The ideal angle for this is approximately 15 degrees. This relatively shallow angle helps ensure the medication stays within the dermis, which is important for proper absorption and accurate testing. In contrast, angles like 10 degrees, 45 degrees, or 90 degrees are more appropriate for other types of injections, such as subcutaneous or intramuscular. So, keeping the needle at about 15 degrees is key for intradermal injections to be effective and safe. Remember, the focus here is on precision and proper technique to achieve the best clinical outcomes. Today, we'll focus on a common scenario in mobility assistance. When a patient has right-sided weakness, the goal is to promote safety and stability during walking. So, which side should they hold the cane on? The answer is the left side. By holding the cane on the unaffected side, the left side in this case, it provides better support and balance. This positioning helps to reduce the risk of falling toward the weaker, right side. Remember, placing the cane on the opposite side of the weakness allows the stronger side to bear more weight and offers better control. This simple adjustment can make a significant difference in the patient's confidence and safety as they move around. It's a key concept in applying effective assistive device use tailored to each individual's needs. Now, let's focus on the first step in managing a fire, which is rescue patients. This is absolutely the top priority because in any emergency, saving lives comes first. When you encounter a fire situation, your instinct should be to quickly assess whether there are people who need immediate help. If it's safe to do so, your first action is to rescue anyone who is trapped or in danger. Remember, while containing the fire or extinguishing it is important, those efforts come after ensuring everyone's safety. So, always prioritize rescuing patients or anyone at risk before moving on to other fire management steps. This approach aligns perfectly with the overall theme of the RACE protocol: rescue, alarm, contain, extinguish, because without rescuing people first, the other steps lose their purpose. Today, I want to focus on the purpose of SBAR communication, and specifically, why it's so important to standardize handover. When we talk about SBAR, or situation, background, assessment, and recommendation, we're really emphasizing a consistent way to communicate critical information. One of the main goals here is to standardize handover processes. By doing so, we ensure that every team member receives the same clear, concise, and complete information, which reduces misunderstandings and errors. This consistency is vital for patient safety and smooth transitions between caregivers. So, in essence, SBAR helps us create a reliable framework for handing over responsibilities effectively. This standardization is a cornerstone for improving communication across the board and ultimately enhancing the quality of care we deliver. So, when we look at normal potassium levels, the correct range is 3.5 to 5 milliequivalents per liter. This range is crucial because potassium plays a key role in nerve function, muscle contractions, and maintaining normal heart rhythm. If potassium levels fall below or rise above this range, it can lead to serious health issues like arrhythmias or muscle weakness. Throughout this presentation, we've emphasized the importance of maintaining electrolyte balance, and understanding these normal ranges helps us better assess and manage patient health effectively. So remember, 3.5 to 5 mx/L is the target for normal potassium levels. Now let's focus on the different oxygen delivery devices and their precision in delivering oxygen. We have 4 main options here: the nasal cannula, the simple mask, the Venturi mask, and the non-rebreather mask. Starting with the nasal cannula, it's quite common and comfortable for patients, but it provides a variable FiO2 that depends on the flow rate and the patient's breathing pattern. The simple mask offers a higher concentration than the nasal cannula, but still isn't very precise because factors like mask fit and patient breathing also influence the delivered FiO2. Moving on, the non-rebreather mask is capable of delivering high oxygen concentrations, often approaching 100%, but again, it can vary based on flow rates and mask seal. Now, the key point here is the Venturi mask. This device is designed specifically to deliver a precise and consistent FiO2, regardless of the patient's breathing pattern. It achieves this by mixing oxygen with room air in a controlled manner, which makes it ideal when you need accurate oxygen therapy. So, in terms of delivering the most precise FiO2, the Venturi mask stands out. It's especially useful in cases where maintaining a specific oxygen concentration is critical, such as in COPD patients who require careful oxygen titration. Overall, understanding the differences among these devices helps us choose the right one based on the patient's needs and the clinical situation. The primary purpose of triage is to prioritize care. Essentially, this means assessing patients quickly upon arrival to determine who needs immediate attention and who can wait. It's about making sure that those with the most urgent needs receive care as soon as possible, which is critical in managing limited resources and ensuring the best outcomes. Triage helps us allocate our staff and equipment efficiently, focusing on patients' acuity levels. So, when we talk about triage, we're really emphasizing the importance of prioritizing care to save lives and improve overall patient flow. This concept ties directly into our goal of providing effective, timely care in busy or resource-constrained settings. Now, among the signs we look for to identify fluid overload, one of the most significant is crackles in the lungs. These crackles, also known as ralls, are sounds we hear with a stethoscope that indicate fluid accumulation in the alveoli. When the lungs are filled with excess fluid, it interferes with normal air movement, creating that characteristic crackling or bubbling sound. Recognizing crackles is crucial because it helps us assess the severity of fluid overload and guides our treatment decisions. Remember, while other signs like a dry tongue, low blood pressure, or a slow pulse can provide clues, crackles in the lungs are a direct indicator of fluid retention in the pulmonary system. This connection underscores the importance of thorough assessment in managing fluid overload effectively.